Well, a warm welcome to this talk. Now, I want to carry on looking at the White House report that was commissioned by President Trump in February on the health of children in the United States. Now, when there's one of these mass casualty events, everyone is horrified, rightly so, of course. But the drip, drip, drip pernicious effect of chronic disease is somehow considered, if not acceptable, kind of normalised. So let me just read a few points from the report before we look at some detail on some of the specific things that are going wrong. American children's health crisis. Today's children are the sickest generation in America's history in terms of chronic disease. Now, that's really quite incredible in terms of chronic disease. Now, of course, hundreds of years ago, more children would die of acute infectious diseases, but in terms of chronic diseases, it's never been so bad. Obesity, heart disease, diabetes, cancers, asthma, allergies, autoimmune disease, behavioural disorders. And there's an awful lot of behavioural disorders, as we'll see. Preventable trends continue to worsen each year. This is, the vast majority of this is preventable. And we'll be looking at some ways how that can be prevented, hopefully, if not in this video, in the next. Federal and state policy have sometimes been guided more by corporate profit than the public interest. Corporate profit is part of the problem. Scientific and medical institutions, complacent, defaulting to symptom management. So complacency means people are often just managing symptoms. And to be fair, doctors can be very good at this, but much better to get rid of the fundamental underlying cause than symptomatic management, as was considered many times. The report says we need gold standard science to prevent and reverse the root causes. Science will reveal much of the truth of this. Some will be economic, we're rooting out corruption, but science can reveal the majority of the problem here, and it's going to be used correctly, we believe. And this report is an encouraging start. Healthcare systems of over-medicalized children, frequently masking and compounding underlying issues. Rising screen addiction and sedentary lifestyles, chronically stressed, sick and isolated generation. Childhood should be the best time of your life. Carefree, happy. Purpose of this report is radical transparency. I like that term. They're looking for radical transparency. Spur a conversation about how we can build a world, a better world. Spur a conversation. Unfortunately, in the UK, we're limited as to what we can say at the moment, but in America, it's not as bad. Farmers are put at the centre of how we think about health. Many reasons for that. I'm not going to go into it now. Healthcare systems thrive when disease is prevented and reversed, not just managed. So healthcare systems on both sides of the pond are bogged down looking after people with chronic diseases. I know this only too well, having worked in it for 45 years. AI technology that will develop new tools and push the frontiers of science, reversing chronic disease. Not so sure about AI. Not that I'm for it, not that I'm against it, simply don't have the knowledge to make an informed comment on that at the moment. 73 million children in America, over 40% of age 0 to 17-year-olds in the US, at least one chronic health condition. 40% of children in the US, one chronic health condition. Over 75% of American youth aged 17 to 24 are ineligible for military service, primarily due to obesity, poor physical fitness and or mental health challenges. An indictment indeed. Now let's go and look at some of the details now. So the first specific parameter I want to look at here is the prevalence of obesity among G7 countries aged 5 to 19. And we see that the United States is quite high at 20%. Now the UK is still high, it's 10%. So still a lot of progress to be made in the United Kingdom. The blue line there is Canada, so the UK in green, but the United States is particularly high. More than 1 in 5 children over 6 years are obese in the States, 20%. More than 270% increase compared to the 1970s. 80% of obese teens will become obese adults, and 70% of youth with obesity already have at least one risk factor for heart disease. So this is, again, pretty concerning figures. So 80% chance if someone's obese as a teenager, they'll become an obese adult. And 70% already have one risk factor for heart disease, this epidemic of metabolic disease. that really is it's a time bomb. Just wait. Well, it is going off already, but it's going to get even worse. Now, the next specific thing to look at, prevalence of pre-diabetes. These are people that could well go on to become diabetic in 12 to 19-year-olds. And we see it's up at this line here is 25%. So we see here we're on about 27%. Aged 12 to 19-year-olds, and that data only goes up to 2018. So more than a quarter of 12 to 19-year-olds pre-diabetic. And just imagine if all these become diabetic, the drain on health services, apart from the human tragedy of it, or the complications associated with diabetes. Now, both type 1 and type 2 diabetes have consistently increased over the past 10 years. Type 1 is where the body stops producing insulin altogether. And by 2060, if current diabetes mellitus trends continue, 65% increase in type 1 and 600% increase in type 2. Something has to be done about this. And I'm glad that the Robert Kennedy's department is looking at this now. And this report is a good start to that process. Now, let's look now at autism rates. And this is 2022 to 2024 here. So this is basically about 2023 data. Here, all the way up from the year 2000 there. And look at that increase. I mean, let's hope that this doesn't carry on. I mean, it doesn't bear thinking about. This needs addressed. Autism rates amongst children, this is by age 8. Alarming increase. Autism spectrum disorder impacts 1 in 31 children by age 8, more boys than girls. Over 10% of children have been diagnosed with attention deficit hyperactivity disorder. Again, it can be quite a debilitating condition. 1 million more children diagnosed in 2022 compared to 2016. So that's only a 6-year period with 1 million extra diagnosed. Really significant increase. Rates of other neurodevelopmental disorders and learning impairments are also increasing. The intellectual capacity of the nation basically is under threat. And we're not that far behind in the UK, unfortunately, as well. We need to find out what's going on in the States and apply that information everywhere. This is what is needed. Over 7.5 million, that's 10% of children up to, I guess that's up to about 16, K-12. Students receive special educational service in 2023-2024. If 10% of children need special educational services, you might think there's a problem. Cancer rates per 100,000 ages 0 to 19. Boys slightly higher than girls, but we definitely see unquestionably the line is unfortunately going up. That is a positive slope up to and that goes up to 2021 on that data, that up to 2021. Childhood cancer incidence has risen over 40% since 1975, and I think my suspicions here lie with environmental toxins, because we know that there's many carcinogenic pollutants that can contaminate the environment. Now, had at least one major depressive episode. So we're on to mental health now. Now, this is girls. Appalling levels of mental ill health in girls. And again, this line here is 25%. So very high levels. In boys, this line here is 10%. So still an appalling situation. But very, very high levels of depression and mental disorder in girls as well as boys. Teenage depression rates nearly doubled in 10-year period, 09 to 19. More than 1 in 4 teenage girls in 2022 reported a major depressive episode in the past year. I mean, this is 25% of teenage girls being significantly mentally unwell. 3 million high school students seriously considered suicide in 2023. This is appalling. Diagnosis of anxiety increased by 61% amongst adolescents between 2016 and 2023. Over 57% of girls reported feelings of sadness and hopelessness in what should be a joyous time of life. And from 2007 to 2021, suicide deaths amongst the 10 to 24-year-olds increased by 62%. You know, people commit suicide when the balance of their mind is disturbed. This is a symptom of severe levels of mental illness and distress in young people. Suicide deaths amongst 10 to 24-year-olds increased by 62%. I've said that, right. Suicide is now the second leading cause of death in teens aged 15 to 19. Basically an epidemic of mental health problems. And the last main one we want to do is food allergies, because again, allergies potentially life-ruining and life-threatening conditions. Here's the graph for this here. Prevalence of food allergies in 0 to 17-year-olds. Now, 0 to 4-year-olds is the red line, 5 to 9-year-olds is the green line, and 10 to 17-year-olds is the blue line. And again, this data here is only going up to 2018. So presumably even higher now. And this line here is 6% of children with food allergies. Up quite significantly from the late 90s down here. Over 1 in 4 American children suffer from allergies. So, 27% of children have an allergy. This shouldn't be like this. Eczema, atopic dermatitis. 12.7% of children have eczema. Between 1997 and 2018, childhood food allergy prevalence rose 88%. It's not far off doubling. It's ridiculous. Celiac disease rates have increased fivefold in American children since the 1980s. Rates of inflammatory bowel disease, including Crohn's disease, appalling disease, Crohn's, have increased by 25% over the last decade. So specific facts there coming from the report, meaning that this is not an illusion. This is real. We could argue about this, about the diagnosis of autism. But there's still no question that the amount is increasing. So clear evidence here of the appalling state of health in American children. Now we're going to go on and look at the factors probably in the next talk. But food is clearly a factor. Ultra-processed food, appalling in the States. Exposure to environmental chemicals, pervasive use of technology, and children being highly medicated. And the report said children are highly medicated. It's not working. So, the problem is real. This report's now going to go and look at some of the causes and some specifics. And in another 80 days' time, I think, we'll be getting a report with a strategy, so concrete steps being taken. So that's the end of this video. As a complete aside, some of you know I'm foolish enough to ride a motorcycle, and every year I go to a local vintage motorcycle rally. And I'm going to show you a clip of that now. But for those of you that are interested in motorbikes or aren't old, thank you for watching. But for those of you that want a slice of old England, I'm going to put it on now.